So there is a mountain of research demonstrating the mind-body connection and chronic activation of the vagal and limbic system. And again, the limbic system isn't actually a system. It's a collection of areas of the brain that orchestrate together in some extent to help the body determine its state of well-being and how to respond to that. Now, I have a document that has over 20 pages with article links to all different kinds of studies demonstrating this mind-body connection and how the body responds to stress and how that affects everything downstream. But right now, I want to go back to what I shared with you earlier about that sympathetic nervous system activation, all that increased adrenaline, and that HPA axis. If you don't know what I'm talking about, go back to video 1 in the series, the vagus nerve for the hypnotist. So we have the HPA axis, the hypothalamus that connects to the pituitary gland, which is the master gland. This pituitary gland tells our body when to secrete cortisol. It tells our body when to secrete different sex hormones. It tells our body when to tell our thyroid to make thyroid hormone. It has a very important role, and it is linked to this HPA axis. So this pituitary gland is going to send a signal, adrenocorticotropic hormone, to the adrenal gland. And the result is we're going to get cortisol pumped. We're going to get cortisol pumped. Again, in a short-term stress, this is totally okay. It's what helps us live. But remember, with both of these, I talked about we have decreased gut function. So our bowels slow down, there's less blood flow, it changes our gut microbiome. We're going to have increased blood pressure. We are going to have increased blood sugar. We're going to have increased inflammation hormones. If you've ever had a canker sore in your mouth or anything that was just kind of inflamed and uncomfortable, imagine the chemicals that are in that little area of inflammation. Imagine that circulating through your whole bloodstream. This is what's happening. And on a long-term basis, something very interesting is going to happen. It's interesting, and it gets a lot of people stuck believing that their autonomic dysfunction, their dysregulation, as people like to say, it leads them to believe that they're dealing with a genetic condition when they are not. So you need to be sensitive to this when you're working with clients. I remember when I wrote my #1 international bestseller, Breaking the Fibro Code, I went into a lot of fibromyalgia support groups to do market research when I was writing that book, to see the language that people were using and to be able to write the book in a sensitive way, but also in a very honest and straightforward way. And at that time, they were marketing all of these genetic tests for fibromyalgia, and these companies were convincing these people that it was a genetic condition, but half of the people who had the symptoms of fibromyalgia weren't showing positive on the genetic test. So then you're like, well, okay, if it's not fibromyalgia, what is it? Well, it was fibromyalgia. Here's the thing. When the body is in this increased stress state, it is going to attempt to compensate. When it stays there for a long time, it wants to compensate. And depending on which cells are stressed the most, those cells are going to compensate. And how do they compensate? They compensate from epigenetic changes. You said, well, Penny, you just said it's not genetic. No, it's not genetic. Muscular dystrophy is genetic. Cystic fibrosis is genetic. Malignant hypothermia is genetic. Ehlers-Danlos is genetic. This is epigenetic, which means it's like a light switch. Imagine a breaker box in your utility room with all the breaker switches for the different rooms in the house. You overload one circuit, that breaker blows. You overload a circuit, depending on which system, it's going to flip a switch to try to compensate. So now, this epigenetic change, the body is going to secrete different kinds of cytokines and chemicals into the body to try to adapt from all of this overstimulation from the cortisol and from the adrenaline and the noradrenaline. And what happens is, in the short term, that epigenetic switch actually helps. It's beneficial short term. It is a survival mechanism. But if we don't return back to a state of parasympathetic dominance, chronic activation, and those chemicals being chronically produced in the body, they lead to physical symptoms. Okay? It's going to lead to physical symptoms. An example of some of the things that are derived from the core vagal, meaning in the brain, and the limbic system, are going to be mast cell activation syndrome, histamine reactivity, I can tell you from someone I know with personal experience, pseudo hallucinations. And that was due to a chronic low-level infection they had in their body that didn't get diagnosed till they had an acute gallbladder attack. When they took out the gallbladder, they were like, oh my God, your gallbladder has been a mess for a very long time. As soon as they took the gallbladder out, the pseudo hallucinations went away. It was very interesting, and I did research on it, and I was like, oh my God, the brain has different ways of getting our attention. IBS and our gut-brain axis, insomnia, eczema, hives, skin flares, and tinnitus or tinnitus, however you care to say it. These are just a few. This is not all inclusive. And what I want to share with you is that Dusick and others showed that by taking people who had not done any vagal training whatsoever, taking those people and teaching them a natural physiologic breathing technique. I'm not talking box breathing. That's not normal. Who breathes? Nobody breathes like that. Does it stimulate the vagus nerve? Yes, but nobody breathes like that. It's a normal physiologic breath. It's remembering how to breathe without holding our breath. When they did that, they drew their blood before and after. After 8 weeks of that training, 1,561 genes, epigenetic switches, 1,561 switched to a healthier state. We're talking tumor necrosis factor alpha, different things that will create a situation where cancer can thrive, other inflammatory and autoimmune conditions, because we've got to throw autoimmune in here too. those genes flipped. In hypnosis, we're facilitating someone going into this parasympathetic dominant state and using hypnotic anchors. We can teach them in hypnosis to do this, anchor it in hypnosis, create a Pavlovian response with a hypnotic anchor, a classical conditioning to activate that parasympathetic nervous system on repeat. Okay? Now, there are pain-related conditions that are tied to all of this. Those pain-related conditions, interstitial cystitis, fibromyalgia. Okay? We talked about the fibromyalgia earlier. There's chronic pain with no structural cause. These are the people who hurt their back, for example. They hurt their back. They go in, they've had physical therapy, they had surgery, everything's cleaned up, and they have no physical reason. There's no physical reason left for them to have back pain. Pain is complex. I'll do a short video on pain. Pain is very complex, but you're going to get the picture here in just a minute because I'm going to show you. We're going to do a video on all the things that cause chronic activation of this. Okay? TMJ, chronic migraines. I've had 2 clients, one that was on disability for bilateral knee arthritis using a walking stick. She came to me for hypnosis for confidence. And after the 3rd session, when we did a lot of emotional release and she wasn't carrying this internal stressor that was affecting this whole system all the time, that had her stuck in fight or flight, she threw her walking stick away. She had no pain left. She actually came off disability. And when you're only 40 years old, what an amazing thing that is. Okay. And then I had another one that was having hip pain. And the hip pain was because they were compensating, because they were having a little bit of a flare of arthritis in their knee. And they were so busy compensating for the arthritis because they were afraid of falling. I talk about this in my pain management hypnosis course. The fear of falling is more damaging to an elderly person than anything else. That is a huge comorbidity for them to have a fear of falling. We worked through his fear of falling, and his arthritis and his hip pain went away. It was one session. It was beautiful. It was an amazing thing. We come back for a 2nd session, and he was just golden. He was good. He was in his 80s. So there are a lot of things that are tied to this. 90% of all doctors' visits are in some way related to a stress-related symptom. And you might be a patient and a potential hypnosis client. Listen, so you're like, I don't have stress. You have to understand that stress doesn't mean what you think it means. And I'm going to break it all down in the next video for you. Because once you understand what stress really is, you're going to see all of this differently, and it's going to open your mind to multiple different ways that you can empower yourself to feel better. Because a lot of terms that we use, a lot of language that we use, we put our own perceptual meaning on it. We put it within our own context of what we think the definition is. And it's not actually what your healthcare provider or your hypnotist may be talking about. I'll see you in video 4 in just a minute. Be sure to like, subscribe, save this video, and share it with someone that you know will benefit from hearing what I've shared with you here today.